Hi, my name's Amanda and I'm going to be your nurse for today. Is it okay if I do a postpartum assessment? Yes. Okay. So I have made sure that the patient has a safe and private environment to perform this assessment. And I've also obtained a birth history, which included knowing if the delivery was C-section or vaginal. And I would have obtained a set of vital signs as well. So to start the postpartum assessment, the first thing I would want to assess would be the breast. So if she were a bottle feeding mother, I would want to make sure that she's limiting stimulation and wearing a tight fitting bra. And if she were a breastfeeding mother, I would want to ask about how feeding sessions are going. And I would want to assess the breast, the nipple and areola area for any signs of infections. So I'd want to check for anything like lesions or any bleeding. And then regardless of feeding preference, I would want to assess the breast for any signs of engorgement or mastitis. And then after assessing the breast, I would move on to assess the uterus, which should be midline with the umbilicus. And so to assess this, I would place my non-dominant hand over the pubic area, and I would use my dominant hand using the side to feel for the uterus, and the patient would be lying down while I was doing this. But I would want to make sure that the uterus felt firm and not boggy, and if it was boggy, I would not want to remove my hand, as this could be a sign of hemorrhaging. And so I want to be sure to assess the uterus every 15 minutes for the first hour, every 30 minutes for the next hour, and then every hour for the next 4 hours. And every day postpartum, the uterus should go lower by 1 finger width, and after 10 days postpartum, you should no longer be able to feel the uterus. And then the next thing I'd want to assess is asking the patient, have you been able to urinate?
Yes.
Okay, and was it a normal rate?
Yes.
And no pain?
Nope.
Okay, and if she had not been able to urinate, I would want to encourage her to try to do that. And have you been able to have a bowel movement?
Not yet.
Okay, so I would want to encourage her to try to get up and have a bowel movement. And so next I'm going to check lochia. So the first stage that I expect to see directly after delivery would be rubra, which should be a bright red discharge. And then the next stage I would expect to see would be serosa, which would be a light pink tinge discharge. And then the next stage would be alba, which would be a white or yellow tinge. And you don't see alba in the hospital. That's something that would happen after discharge. So the next thing I would check would be episiotomy or the perineum area. So some things that I would want to be assessing for that would be redness, edema, ecchymosis, drainage, and approximation. And then I would assess the lower extremities for any tenderness or pain, any heat, and this is assessing for blood clots, which are common or can happen after delivery. And then I would want to assess, while I'm in the room, the emotional attachment between mom and baby, and make sure that mom is providing baby with the needs such as holding them, making eye contact. And while doing this, I'd also want to assess for any signs of postpartum blues in mom. And before leaving, I would make sure that mom didn't need anything else, and then this would conclude my postpartum assessment.